Hi, recently I put an image of the biopsychosocial model for pain management as I view it and the way I talk about it in my book, The Pain-Free Mindset. I actually broke down the barriers that are normally shown, the three circles there, to say and to indicate how unified a person is when they are suffering from pain, and that we need to be looking at all three of this. I received a lot of engagement about it, and a lot of it was positive, and I said thank you for that. However, there were some objections about the use of the biopsychosocial model in this context. And to me, this is really surprising. I'm the clinical lead for pain management in an NHS service. I'm also the clinical lead for a long COVID service within the NHS in my area. And what's surprising and unusual for me is that when it comes to managing long COVID, there are a lot of people who don't like the biopsychosocial model because they say that too much emphasis has been given on the psychology and not enough on the biology and the social. And in pain management, the same issue happens, but in a different way. People don't like the biopsychosocial model because apparently too much emphasis has been given on the biology, but not enough on psychology and social. I hope that resonates with you, because to me, that is not a clinician's unfortunate fault that we've been changed that way. To a certain extent, it's how society has chosen to fund certain treatments for these conditions. From my perspective, the biopsychosocial model is a very useful framework. It's almost like a mental model for me to say that a person can never be completely separated. You can, for the purposes of an experiment or a clinical trial, separate it and investigate only one bit of it, because that's the paradigm of how we do testing. We want to take out all the confusing or extraneous variables, and we just want to look at one or two matters of interest. But in reality, we know that a person is complete. A person lives in a society, a person has their own feelings, a person has their own beliefs and their morals, and that's going to guide their behavior and their intentions. And that way, a lot of pain management, or long COVID for that matter, has its roots that we need to see the whole person. We need to look at the biology, never forget that there is a change that's happening, and that will impact on their psychology and how they interact with others in the community. And that community is the social element on how everyone else then interacts with them. So it's very difficult to separate them at all. And where I talk about in my book, I mentioned the concept of this part, this immune cell called the microglia, the immune system, that can be actually a common unifying factor for both these conditions. So there is that bit of biology that can be common between all these conditions where chronic pain is a persistent feature. And I would want to say that the biopsychosocial model helps me in that construct. And there are a lot of clinicians who actually use and think about the biopsychosocial model in that holistic perspective. We are sometimes forced to focus on one over the other, but that doesn't mean we should forget the other two. My aim with all those graphics and bringing the whole image together was to make sure that we understand that each time we look after a patient in pain, we give attention to what we are good in. So a psychologist may pay attention to the psychology, a clinician, a medic may pay attention to the drugs or interventions. But then there must be an equal focus on the end, the neuroscience, the diet and the microbiome, the sleep, the exercise, and the mind-body therapies. And that is the complete sort of pain-free mindset and the biopsychosocial framework in which it sits and it hopes to cover. Thank you.